Welcome to episode 46 of the Birth Words podcast. In today's episode, I get to introduce you to Dr. Michelle Coates. Dr. Michelle is a chiropractor who specializes in caring for people during pregnancy and childhood.
Welcome to Birth Words. Words are powerful. What are you doing with yours? In this podcast, birth doula and applied linguistics scholar Sarah Pixton invites you to be intentional, reflective, and empowering with your language as we come together to honor those who give birth. The work of Birth Words is to elevate the language surrounding pregnancy, birth, and the postpartum period. Nothing in this podcast should be taken as medical advice.
Before we jump into the episode today, I want to remind you that this Wednesday, May 13th, I am releasing a sneak peek introductory class for birth workers, talking about the power and complexity of our words. I know at this time, many birth workers have been changing the way that they offer support to their clients. Due to the COVID-19 pandemic, many birth workers are not able to be in the space with their clients when they're giving birth and have offered a lot of support through virtual means, whether that's phone calls or texts, Zoom conversations, etc. And so I think this is a really timely topic to discuss language and why communication can be so complex and how we can better understand and better communicate with each other. So this little class is available at birthwords.com/classes. Again, it's an introductory sneak peek to the full in-depth class that's coming out at the end of the summer, but I hope that it will give you some important content as you support your clients during this unique time. And this focused class will give you some opportunities to reflect and think about how to be intentional and empowering with your words as you support your clients. So head over to birthwords.com/classes to check it out now. If you're listening to this prior to the 13th, it is available for pre-order. So head over there and pre-order, or if it's past the 13th, go ahead and purchase the class. And now we all get to meet Dr. Michelle. Babies and pregnant bellies are two of Dr. Michelle's favorite things in the world. She finds it a joy to support families through such an important time of change and transition. She has dedicated herself to extensive training in order to provide her patients with state-of-the-art pediatric, prenatal, and family-based care. She is certified in the Webster technique and is also pursuing her fellowship in pediatrics with the International Chiropractic Pediatric Association, ICPA. Welcome, Dr. Michelle, to the Birth Words podcast. I'm so excited to talk with you today.
I'm super excited to be here. Thanks for having me.
Yeah. So I wanted our listeners to get to know you a little bit. Can you tell your story about how you came into birth work?
Yeah, so I am a prenatal and pediatric chiropractor, as you probably already heard. And I kind of feel like birth work found me. As a young child, I loved babies. I've always loved babies. And I thought I wanted to be a pediatric oncologist in college. And that kind of shifted as my views of medicine and health shifted a little bit. And I found chiropractic as a natural form of giving the body what it needs without putting anything from the outside in. And when I learned that babies and pregnant women can get adjusted, not only can they get adjusted, but it's amazing. And the transformational powers it can have in pregnancy and birth, it was like, sign me up immediately. So I love dealing with women. I love supporting women through the process of birth and then being able to meet the baby on the other side and support them as they grow and change. It's a really amazing full circle process.
That sounds awesome. It sounds beautiful. And I love how you said Oh, I'm trying to remember exactly what you said, but from the inside out instead of the outside in, the care that you give of making sure your clients' bodies are working optimally and like how well that fits with pregnancy and birth. That's awesome. And I don't think we mentioned yet that you get to work with your husband as well, and you have your business there, which is so cool.
Yes, it's fun for sure. And it's awesome that we both share, like, I really love the pregnancy baby side and he loves older kids. Okay. So it just creates like this full circle, again, whole families, but we each have our favorite areas to work with.
So cool. Okay. So using the perspective of your physiological understanding of pregnancy and birth, how would you describe pregnancy and birth to someone who is about to experience it for the first time?
This question is really hard, at least because pregnancy is so complex. And honestly, I think of pregnancy as a transformation. It's mental, physiological, and emotional transformation, because a woman becomes pregnant and she's never the same. Her brain changes on a physiological level. Her body's changing. The nervous system of baby and mom are interacting and communicating on levels that we're not even aware of for the most part. I mean, as baby grows and you feel them kick, you're more aware of babies. But even from conception, the first thing that forms is the nervous system of the baby. And they've found that they're communicating with mom's nervous system back and forth all throughout pregnancy. And so to me, it's really this beautiful process that moms get to experience as they not only physically are transforming, but they're emotionally becoming ready to take care of a baby and interact with this baby that's growing inside of them. I think it's one of the coolest, most amazing things that happen in any animal species, but especially the humans.
That's so cool. Thank you for sharing your thoughts. I love to hear how different people talk about pregnancy and birth, because I think that the experiences and the perspectives and the expertise that we have influences the way that we would describe it to somebody, and like the different things that you focused on in your description. I loved how you talked about all the different aspects of the transformative process of pregnancy and birth. But you focused a lot on the nervous system. Is that something you're really involved with? And I just really appreciate hearing your perspective, because pregnant women hear a lot of different descriptions of what pregnancy is going to be. And sometimes they're more awe-inspiring than others. So I appreciate your description. That was cool.
Thanks.
So then I know you're passionate about providing support and opening doors to empowerment for birthing families. So in addition to the physical work that you do with your clients, obviously as a chiropractor, most of the work that you do is physical. That supports them through a more comfortable pregnancy and birth. But how do you also use your words to support and empower your clients?
Honestly, I think of myself as part of the woman's birth team. Like, I'm on her team. And I have a unique, standpoint in the sense that, honestly, I get to see moms a lot more than their OBs and midwives sometimes, depending on when they're coming in pregnancy and, where their bodies are at. Sometimes they need a more frequent check-in than once a month or even once a week. And so I love that I get to see more of that human interaction side. Like, I get to ask moms, how are they feeling today? And not feeling in the sense of it hurts in my low back, but emotionally, how are you doing with this stage in pregnancy? What are your fears and anxieties, and how are you handling them, and who's on your team? And one of my really important, stances that I feel like every woman should have access to good information that allows them to make the best decisions about birth that are right for them. So part of my day-to-day support with words is really like asking who's on their support team. Do they have a doula? Do they have a pelvic floor PT? Do they have, if they're in my office, they have a chiropractor. Are they using an OB or a midwife? Or who are their friends? Who are their spouses? How are their kids handling it? It's really that I love the connection side of pregnancy, that I get to become someone who's constantly encouraging and supporting and telling them on a physical side that how well their body's doing and what things are changing and how their body is meant to do this. Because I think in our society, birth is definitely a time where physically it can be fearful to be in pain, because we, consider labor and delivery to be a painful experience. I think pregnancy often becomes this fearful thing, or people think that it's going to be miserable and that they're going to be uncomfortable. And it's been amazing to see the moms that I take care of have a really different experience in their pregnancy. It's not something that I'm not saying they're not uncomfortable at certain times, because that comes along with pregnancy, but really being able to enjoy and tap into the transformational experience that's happening in their body and the emotional side that I already talked about is just really cool. So I love being able to be a more frequent positive support in my office, I guess.
I love that. I think that's beautiful. And anybody would be so fortunate to have you there as this positive voice on their birth team. I love how you said you consider yourself part of that team. Even though I'm guessing you're not often in the room when your clients give birth. You play is that true?
That's true. Only a few will have me come to adjust them during labor.
Which is extra awesome. But yeah, that you're playing this critical role throughout their pregnancy. And I love that you're coupling it with these really thoughtful questions, right? It stood out to me that when you talked about the words that you use to support your clients, you talked a lot about the questions that you ask them so that they can be telling you about where they're coming from and what choices they've made, and then you can point them towards other resources and help them make those decisions that they need to as they keep going. It sounds like you are really good at developing a relationship of trust that then they feel like you're a resource that they can turn to.
I hope that that's what I'm doing, because I feel strongly that every woman should have someone they can trust to give them good information. And like you mentioned, it's really the mom's choice about whatever she wants her birth to look like. I think too many times we take away that choice and it just becomes how we do something. And moms should really know that it is their choice. Their birth gets to be, obviously it's unpredictable in some ways, because babies have minds of their own. I truly believe babies choose how they want to be born. But also moms need to have that peace and calm that they have a voice and a say in the process.
And I feel like just the things you're doing help them to recognize that they have that voice. And I remembered when you were talking that I loved how you talked about as you're working with them physically, you can talk about how their body's just doing what it's designed to do, that everything, just instilling that perspective that your body was designed to be able to be pregnant, and wow, it's going through this remarkable transformation, and we're going to work through it to make it as comfortable as possible, but just reinforcing the amazing work that their body's doing. I think that's awesome.
Yeah, because it is a natural process. Our bodies know what to do. You didn't think about growing a child.
Right.
It just amazingly grows.
Yeah.
And so I think the more that we can return that trust, the more women feel in control and enjoy their pregnancy.
Oh, I like that. Cool. Well, thank you so much for joining me for a little bit and sharing your thoughts and your expertise. My last question for you is, if you could choose just one word to summarize your feelings about pregnancy and birth and the role that you play, what would it be?
I choose empowerment because, as we've already talked about, it really is helping women reclaim their power in birth, whether it's physical, mental, emotional, whether it's giving them the tools educationally. It's allowing them to know their body has the power to birth this baby. They get to make the choices, and it's their own transformational process.
Love it. Thank you. And if our listeners want to connect with you on social media or through your website, what's the way that they can find you?
So our Instagram is Amplus Family Chiropractic, and our website is amplusfamilychiropractic.com. So we would love to hear from you.
Cool. And that's AMPLUS, right?
Yes.
And we've got listeners all over the country, even I think some international, but several are in Utah, like you and I are. So you're in Sandy, right?
Yes.
Great. So if you're in the area and you're looking for an awesome chiropractor to add to your birth team, definitely give Dr. Michelle a look.
Yeah, and even if you're not local, I try to do as much education on social media as I can. So follow us.
Cool. Yeah, I've seen that recently too. I need to check out more of that. That looks like an awesome resource, especially now. Everything's virtual anyway. So wherever you are in the world, follow Amplus on Facebook and check out all the resources they're putting out there. Yeah.
Yeah.
Okay. Thank you so much for joining me.
Thank you for having me.
If you're interested in sharing your ideas or experiences on the podcast, go to birthwords.com. If you're liking what you hear, please leave a review on your podcast app. For more resources about language for a better birth, subscribe to the monthly newsletter at birthwords.com and follow Birthwords on Instagram and Facebook.